Are you experiencing back pain that you can't get rid of? Getting migraines, vertigo, having trouble sleeping, and/or brain fog? Do you feel like your medical doctor doesn't understand your condition? Blair Chiropractic might be the solution you've been looking for. If you've ever been skeptical about this, the two doctors you're about to listen to were even more skeptical than you were when they looked into chiropractic work. But fear not. Get expert guidance from the blonde and the bald, Doctors Beth Bagley and Frederick Schurger. These two doctors have extensive experience beyond the healthcare realm and bringing unique vision and healing to their patients. What do you have when you get a biological analyst and an engineer together? Find out right here on another episode of The Blonde and the Bald. Welcome your hosts, Doctors Bagley and Schurger.
Welcome, everyone, to The Blonde and the Bald, and we are just having a grand time. We won't tell you why, but we are having a grand time already. It's been a wonderful week. I mean, it's gorgeous weather here in the Midwest.
Unbelievable weather. And you know what? We should record our when we're just talking about the show, because I think it's going to be more interesting than most of our shows but there are curse words that are said that we're not going to say, sorts of things.
And then the people who do production have to do extra work on the show. And yeah, exactly. It just beep. No,
oh my gosh. No, it's just, you know what? Sometimes there are just hard people that come into the office and we love on them and we give them all of our energy, and
it takes a lot.
It does. It takes a lot to be a doctor.
Some days it takes a lot out of us. I mean, we joked a couple episodes ago about, wow, it doesn't look like you work a whole lot of hours. And it's like, no, we the hours we work are the hours that are allowed. The hours we don't work are us decompressing.
Or just doing other work.
And doing other work.
We just don't see patients during those hours.
Right. But oftentimes it's a lot of, I need my quiet time. I need my thing. Yeah. And at the end of the, so even after, this is a full day for us, but after a full day, I go home, I eat dinner. My dinner is consistently the same every night.
It's meat with eggs and meat. No,
it's eggs and bacon. And there is some extra fat. You are correct. And then I have my little bit of keto brick. And then maybe if I'm craving popcorn, I might pop up some popcorn.
He's so boring.
Yeah, it is. And it's great. Because
I know you love that.
I know I have that. And then this is my, all right, I'm going to decompress and I'm going to read my book and I'm going to figure out what's going on in the Wheel of Time series now that I have been exposed to this piece of fiction. Opposed to trying to go and
is that the books you're reading right now?
Yeah, I'm reading the
Wheel of Time. I just watched that on
Amazon.
Is it Amazon? Yeah.
Yeah. It's the first book. It's a weird little adaptation, and I don't know. There's parts that I'm like, after having read the book,
yeah,
and then going back.
Books are always better.
The books are always better, and I'm begging questions as to why they did it the way they did it. But I don't care. Whatever. Probably because they had to get people on contract and they had to show.
Oh gosh, yeah. I mean, one of the things I ran into this week in the office was a patient having done some research on the vagus nerve. And
yes.
She had some weird reactions in her body to actually a dental procedure. And I love that you're going to be going over some of this stuff today, because absolutely. I actually want to relearn some of the things, because you're really good at that. And what I will try to do for everyone is what he says, I will bring it into an English translation out of science translation.
Because a lot of this is going to, because the presentation and the slides that we're going to use were from something that I presented to a group talking about how do we measure this? What is the importance of measuring they're really small electrical impulses in the body and how important they are. And it's at a high level. It's taught to doctors, and doctors need to understand this, but we got to translate it down to the patients, and sometimes we got to translate it down for ourselves just so we can even understand it.
For sure.
So let me get this slide up here, and for those of you who are listening, there's some stuff here that might be worth watching on YouTube as we do this. One of the phrasing that I like to use is something called attenuated autonomic insufficiency, which really just boils down to say that your autonomic function, the automatic operating system, as it were, of your body, if it is out of balance, it is attenuated. It is less than where it's supposed to be. Now, is it keeping you alive? Yeah. But there's a difference between being alive and in a coma and effectively in a vegetative state. And then there's a different, and then you have, high level athletes. Michael Phelps comes to mind, who for 12 years, he was at the prime of his swimming game. And now you've got other people in other sports who are doing the same thing, trying to figure out how they can be healthier and stronger. And and you were joking about the meat diet, but Dr. Sean Baker, who is sort of one of the lead folks in the carnivore world, he's setting in his 50s, all natural, never done drugs as far as hormone replacement type stuff in that regards. And he is still the world record holder in one of these rowing competitions.
Wow.
So, and the man is not any small man. I mean, you think he's probably 6'4", I guess around 210, 220, somewhere in that range, deadlifts all the time. I mean, he is, he played rugby and football through high school and then into college. So, and he can do these sprint level activities largely because he's doing things to bring up his ability for his autonomic nervous system to function better.
So real quick, I want to explain autonomic. So you said automatic, which is,
yes.
So that's a great way to say it. But in school, if you've taken a psychology class, you may have heard something like flight or fight, which is a part of it. And he's going to go over that. So I want you to start thinking about, there's two types of like nervous systems out there. We've got the stuff that we can control, like moving our arms and legs, yep, and taking a deep breath in on purpose, right? And then there's the things that we don't really control, which is if you're sleeping, how often are you breathing? Or right, if a bear walks in the room, what does your heart rate do? So that's the kind of difference is like, you don't have to think about your heart rate right now to make it go.
Yeah.
So we're talking about those automatic functions of the body.
Exactly. And when we start thinking about, the motor functions of the body, the voluntary stuff that we are doing, as you pointed out, just how fast do you want to walk down the road is sort of dictated by how fast you can walk. Whereas these autonomic impulses, you've got two sides to this. So you've got your voluntary stuff, and then you have your automatic stuff that you can influence, but it's always going to run at some level. And this is, yep, this is the question: how do we improve that autonomic function through various modalities? Chiropractic is certainly one of the very powerful ways that you can do this. But one of the crazy things, and I broke down and bought a 110-gallon feed tub, filled it with water, and I have been in it every morning this week. It is awesome.
Are you putting ice in it too, or are you just doing? Okay.
No, it's just outside, and it's sitting at about 45 degrees. So it's cold. I mean, I'm not going to pretend that I'm in there for 10 minutes. I mean, this is not go sit and enjoy yourself in the hot tub. This is, I've got a minute, the timer goes off, and I'm done. And it's actually, what's funny is after being in it for about a minute, again, we're talking, I tested the water temperature this afternoon. It was sitting probably about 45 degrees, which is probably where it's been sitting all week. Because it's been up to the 50s here in the area.
Even though it's February and it's supposed to be like way colder than that.
Yeah, well, it's supposed to freeze tonight. So
okay. So you'll have an extra cold bath tomorrow.
So I might have some ice that I got to crack through to get into it. We'll see. We'll see what happens. But the point being is that kind of cold exposure actually influences this autonomic response and sort of improves our body's ability to function by doing some things, because the cold, by immersing yourself in the cold, you have to, and in order to stay there, you have to control your breathing. And as you control your breathing, you start impacting these other systems, which is crazy, because it just starts getting things better, especially as you get used to it. And the irony of the thing is after being in the cold water, I get out and I'm drying myself off because I'm going back into the house to get my coffee, but it doesn't feel nearly as cold as when I was in the water. So anyway, so let's talk about this automatic nervous system. There are two sides to this coin. The fight and flight, which is our sympathetic. This is when you have a lion chasing you and you got to get away right now. And it doesn't obviously need to be a lion. It could be a lot of different things. And there's actually 3 F's. But again, this is a family-friendly show. So it's fight or flight. And most people can figure out what the third one is because it's not family friendly.
No, not.
And then the parasympathetic side is rest, digest, and heal. And there's a balance. You need both. If you only
absolutely need both,
because if you only rested, digested, and healed, you'd never get out of bed.
Yep.
Whereas, so in the morning, your sympathetics come on. They turn up. In the morning, you have that cortisol reaction that helps wake you up, warm up your body, which is why I happen to cold to sort of kick that into overdrive a little bit. And then when you're ready to go to sleep, as I'm reading my book and I read the same, actually, usually what happens is one eye goes this way and the other one goes that way. And the words just start turning on the page. And I'm like, I'm just going to put the book down and I'm going to fall asleep. That's the parasympathetic trying to bring my brain down to say, all right, you're ready for bed.
And that's a really good point, is that if your sympathetics and parasympathetics are out of balance, a lot of people will have sleep issues like insomnia.
So.
They can't I can't turn my brain off when I go to sleep. Yeah, that's because your sympathetics are going blah, 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 and your parasympathetics are turned off or low. And so, and that chiropractic actually helps a lot with that, but
very much so.
We're going to talk some other things too. So
absolutely.
Keep going.
Absolutely. So the sympathetics, there's a couple different spots that it sits. It sits basically in the brain stem area. Certainly part of it in the cortex, as I've got on this slide here. Some in the hypothalamus, but this is all brain stem, and this is high level brain stem going on down. And then it comes out. Most of the sympathetics traditionally have been taught that they come out of your spinal cord along basically your upper back, T1 through L4, but yet there is some older research that suggests it actually has higher levels that it actually comes off the spinal cord up to C4 or C5. So there's some question into that. And then there is a couple of ganglions, something called the stellate ganglion that actually comes up from those lower ones that come up into the neck. Stellate ganglion, is that right? I think so. That
maybe.
Seems right. It seems right. My brain, sometimes words come out of my mouth and I'm mixing stuff up, but I'm pretty sure that's the stellate ganglion.
Maybe you need an adjustment.
I'm actually probably pretty good, but that's another story.
That's exciting.
I know. It's good. It's nice to have held a week. But in any case, so, oh no, it is the superior cervical ganglion. And then you have a couple of others that are coming off the cranial nerves for both your ophthalmic C5, or cranial nerve 5, which we were talking about. This is part of that trigeminal nucleus. And then you got the cranial nerve 3, which is largely involved with eyesight. So there is some sympathetics on that side. That's a lot of your pupillary light reflex. So then you have, and that's a slow response. That is, as funny as it sounds, it's actually a slower response to the dangers around in your life. And unfortunately, we live in this fight or flight response most of our time. Now, the parasympathetic side, again, this is more rest and digest and heal. It tends to be faster. And we have, again, that ciliary ganglion. In fact, the parasympathetic is what causes it to contract opposed to open up. So most sympathetics are going to cause a contraction of vessels. Certainly, it's going to raise your blood pressure. It's going to warm you up. It's going to make, get your heart rate going. Whereas
get your muscles ready for action.
Right. Whereas the parasympathetics are going to start driving you down and start relaxing you.
Yep.
So we've got a couple different nucleuses, a couple things. I'm not going to get into it we're going to focus on vagus. And that's going to take a long time. And then you have the pelvic nerves coming off the sacrum or your tailbone that actually get the lower half of what we're not going to really cover the pelvic nerves. We might cover them cursorily, but the vagus nerve is what I want to focus on right now.
So vagus nerve is spelled VAGUS. If you're listening and not watching, you can see it on the screen. It's also known as cranial nerve 10.
Correct.
So a cranial nerve is a nerve that doesn't come out of the spine, but comes out of the brainstem area. So that's like all the way at the top of the neck, above where you can like feel your skull.
Right.
And so cranial nerves are really important, and they pretty much are what's keeping us alive right now. Our brainstem is really important, and those cranial nerves are too. But vagus gets a lot of attention because it is impacted a lot. I see a lot of people with trauma responses and vagus nerve. I don't know what to call it, inactivation or activation. It's almost like inactivation. It like needs to be activated. I don't know. We'll go into it.
Yeah, and we're going to touch on that because this has become in the concussion space and a lot of other health problems. This has become one of those. It's not quite a buzzword, but it's definitely a buzz because it's becoming more and more popular. Not only in certainly chiropractic and how we apply it, but also in most healthcare and most medicine is looking at this a whole lot closer than they used to. So I still need this t-shirt.
That would be good.
Yeah, it would be good. But so for those of you who are watching at home, what we have on the right is a picture of your brain. Is your spinal cord in this? Not really. And your brainstem, and all of the parts and pieces of the vagus nerve. The vagus nerve is unique because it is one of the few cranial nerves that not only drops out of your skull, but it actually drops down and affects so much in your body. And we're going to go over sort of the branches of that. I know this may come out a little bit more academic, but I think it helps to visualize all these pieces. So it has nerves that go most nerves go one direction. The vagus is unique because it actually has directions in and out of the out of the brain. So your afferent nerves, they come back in, they tell you what's going on. Your efferent nerves are going out. I believe that's correct.
Yeah. So it's two-way communication within one nerve bundle,
right? Where
a lot of the nerves can only just be one directional, and there's other nerves that do the other thing. Right. So this one does both.
Right. And it's mostly the ones that are looking out into the system and feeding back into the brain. I mean, it's, it has some that go out, but for the vast majority, it's sort of looking at what's out in the body and feeding back, which is why there's 70 to 80% of them are considered afferent. Now, the hub of the vagus nerve is something called the nucleus tractus solitarius. This will come back a little bit later. But we call this the NTS, and again, nucleus tractus solitarius.
Okay, so when you call it a
major hub,
what would someone what is that? What is that in? Where is that?
So it's in the brainstem, just above the atlas, which is the first interesting thing about it. When I call it a hub, I would definitely think, let's say you have a dozen USB devices that you have to that you're interacting with for your computer.
Yep.
Now, most computers, my laptop has really two inputs into, two USB inputs, but I need all 12 of these feeding in. So they make little adapters, little hubs that allow you to put multiple things in, and then one wire comes out, and your computer can make sense of all of that stuff coming in. This is exactly that kind of hub where it is aggregating might be aggravating some things too, but it is certainly aggregating all of that information into that one spot, and then it disseminates stuff to the rest of the body on that parasympathetic, that rest digest side of the nervous system. So that's why I like to have people think about it that way, because this is your major input to tell your body, hey, how do I start relaxing? How do I start doing things? And, a lot of those afferent nerves are perception for inflammation of the body. So go jump in a cold plunge.
Are you going to go through where these nerves are going?
Yes, that's next.
Okay, perfect. Because I think that's very interesting.
Right. Because the first branch, and then this is where we're going right to, comes around the posterior, the back of the spinal brainstem cord area, and actually innervates the meninges on either side of your brain. So let's talk about the meninges real quick. There are 3 levels. We've heard of meningitis.
Okay.
So meningitis is an inflammation of the surrounding tissue, not brain. It's not the brain, but it's the tissue around the brain.
It's and like the covering.
Right. And we actually have 3 levels of meninges. We have the dura, which is considered the tough mother. This stuff is really, really rigid. It is trying to protect your brain from everything outside. In fact, that's the blood-brain barrier that's going on. The next one is the arachnoid, which has a lot of vessels around it. That one's a little bit tighter to the brain. And then the last one is the pia. And the pia matter is right on top of your spinal cord and your brain. And that stuff, again, this is the stuff that, and the material that interacts with your brain and your body. So that you have 3 layers to prevent you from directly getting stuff into the nervous system. We don't want, you've got a box on your computer. You don't want just anything to get into the box, especially if it's sitting underneath your desk and your foot decides to go into the CPU. That's a bad thing. So that's why we have these things. So
it's protection. It is a protective layer.
It is. But yet it has sensory inputs via the vagus nerve. So
interesting.
Yes. So I'm not going to get into much detail, any more detail on that, because that's a whole other ballpark.
The interesting thing I want to bring up, which might be validate some people, is if someone feels like they have pain in their brain, like a migraine.
Yes.
Can we relate this possibly to a vagal nerve problem?
Could be. I mean, I would not rule it out, but a lot of that brain burning pain may not come from this.
Okay, that could be something else.
Right, because pain fibers often, I would say that's probably more a vascular issue overall.
I think it could be a mixture.
I'm certainly I'm not going to rule it out, but I would definitely say, based upon, like I said, I would not call this a pain fiber necessarily, although 70-80% of it is looking at inflammation. So there may be other inflammatory things going on that are subclinical, but yet you can still feel it.
Yep.
So the second branch, so we're on the second branch now. This is what they call the auricular or Arnold's branch, and it helps control some of your perception. A dermatome is basically your skin sensations, as far as how the nerves sort of perceive what's happening at the skin level, which is different than how your body moves. It's really curious.
And it's like, the placement's different. So like if someone has shingles per se, like somewhere on their body, it's usually on one little section on one side of the body.
Following the nerve.
Following the dermatome, following that nerve that's going to the skin. So that's why when you've hopefully never had shingles, but if you know someone who has had shingles, it's always like very commonly like across the side.
Yep. So the second branch comes around the auricular. So that's all ear is what they're talking about there. And
that's on the skin level.
This is on the skin level. In fact, if anyone's ever heard of some of this auricular therapy that exists, where they go into the ear, or that, what is that one piercing that
Daith.
Yes. Yeah. That is influencing this vagus nerve, because again, it's
which is what I bring up about they get Daith piercings to stop migraines. That's what people are doing.
And people ask me, does it work? And I said, it's only $30. It's painful. So a lot of people.
I've had some patients say that it anecdotally that it's helped, and I've had some that said they didn't see a difference. So
same. In fact, one of my patients, she said she got both of them hoping that it might help, and she's didn't do anything. So, the only thing that was touching her migraines was getting her head on straight.
Yeah.
But her comment to me was, but I keep it so that I look like I'm the cool mom at church.
They're actually kind of hard to see. I don't usually see them on patients until they're on their sides about to get adjusted. And I was like, oh yeah, you've got one of those. Because they're like on the outer ear, but on the inside of the outer ear.
Yeah, well, it's sort of it's supposed to be right here on this little
I know, but it's not easy to see.
No, they're definitely not easy to see. And once you've got it, you might as well keep it because it was super painful and maybe it's helping a little bit.
Yikes.
But this is a lot of inner ear stuff that's being influenced by that second branch. And there is some influence as they're using electrical vagal stimulators to improve vagal tone overall in the body. And there's some really good evidence that we should focus on the left ear over the right ear, which I will come back to. So the third branch is the pharyngeal, the pharynx, and the soft palate. It's your mucous membrane. So all that secretory IgA stuff that we've been talking about on and off, that's where this is being influenced by. So, but the pharynx and the soft palate are important because if you've ever had a popsicle stick without the popsicle on it stuck into the back of your throat and had the gag reflex, that is that branch of the vagus nerve. So if you're the kind of person who says, yeah, I can brush my teeth and
you never gag,
you never gag, your vagus nerve isn't working here.
It's not a good thing. You're supposed to be able to gag. You should gag.
Yes, exactly. A gag reflex is a good indicator that this is working properly. So if you're not gagging, and especially not on the right, and I'm coming back to that, just, I'm teasing for something coming up here in a little bit, but if you're not gagging on the right, we have other problems. The fourth branch, this is the superior laryngeal nerve. This is getting into your thyroid cartilage, cricothyroid area. So your tension of your vocal cords for your higher notes that I cannot hit, but Dr. Bagley can very well. And then,
another aside is when my head, I'm a singer, and when my head is not on straight, I absolutely can tell a difference in my voice and my ability to steady my voice.
Yep.
So there's a couple things that are, but I do think that this is part of it.
Yes. And it wouldn't surprise me that, we have some vagal tone influences, because I'll come back and explain why the atlas can influence the vagus. So, so the fifth branch, we're on the fifth branch, folks. So more recurrent laryngeal nerve, but this addresses the muscles around your larynx, your esophagus, your trachea. Again, what you're describing as, your inability to sing as well coming through here. Mucous membranes, again, we are, all the mucous membranes are influenced by that vagus nerve.
Like dry mouth?
Could be. Definitely could be related. What is there's an autoimmune condition where everything is all the mucous membranes sort of dry up. It'll come back to me like after dinner. But the sixth branch is the right and left superior cardiac. And this is the deep and superficial cardiac plexus is formed here. So when we say deep and superficial is right at the top of your, on the skin, on the surface. Deep is when it starts going deeper into either the nerves or into the muscles or into the body overall. So that's what we mean by deep and superficial. But we're getting into and creating the cardiac plexus. So, this is the cardiac supply for the heart, or it ties into the cardiac supply for the heart, along with the sympathetic nerves. So if you have just run a mile and you're waiting for everyone to catch up and you're trying to catch your breath, this is where the parasympathetics are trying to bring down that heart rate back to a normal level.
It's Sjogren's.
That's it. That's
there
it. Thank you. I don't have to think about it after dinner.
Sjogren for anybody who doesn't, because it's spelled really weird. It's not how it's said. But I thought that's what it was, but I was like, I'm gonna look it up so I don't look dumb.
Exactly. Well, this is why the internet is great. And this is also why if the internet goes down, I will have reference books handy.
You and my husband both. You guys love your books.
Yeah. Well, there's a lot of them. But here's the interesting thing. This is the last branch of the vagus nerve before it enters the chest. So far, the vagus nerve starts, I'm going to say maybe, it's taking certainly care of the ear. It's coming down, getting the throat, getting the back of your throat, getting into your thyroid area, into your esophagus, into your larynx, and then it starts sitting right up here. Before it goes into the heart itself, it starts mingling with the sympathetics for the heart, and then it drops into the chest. And this is the first branch in the chest. So you have your inferior cardiac branches that are deep into the cardiac plexus. The left originates from the recurrent laryngeal nerve, which is just another one of those, which is another nerve that's out there, but it influences the atrial ventricular node. This is the bottom half, again, the inferior cardiac branch of the heart. But the right branch, so we've got the left branch gets the AV node, which most people don't think about, but the right branch is the sinoatrial node. This is your lub-dub, or the very, the big part of your heart rhythm is being controlled by the sinoatrial node. This is where heart pacemakers are being influenced. So this is why stimming the right ear might be a problem, because it could have a direct impact on that sinoatrial node. So this is one of those, definitely talk to your doctor if you are investigating this pathway, because there is some back and forth as to whether or not that's safe. And certainly it is also a concern for us as upper cervical doctors, when we have a patient coming into our office who has a pacemaker, when we get them adjusted, that pacemaker is geared to run at a certain rate and sort of help make sure that they're working good. A lot of people, after they get adjusted, can have pacemaker problems. So you need to be aware of that and make the patient aware of that after their adjustment, that there might be some changes, as well as, hey, they might need to call their cardiologist and have a tune-up just to make sure everything's working the way it's supposed to. Same thing applies to blood pressure as well, because you get an adjustment.
I see that more often.
Yeah, and I think that's going to be more common. I haven't seen
pacemaker in a long time.
I was just saying,
maybe they're not doing it as much.
Wouldn't that be grand?
I think because they're doing ablations more now.
That might be.
Maybe they're not going to pacemakers as much, because I honestly remember 10 years ago I saw them more, but I don't really see them as much.
Agreed. And I think the other thing is we've gotten much better about how we address heart disease across the board. I mean, heart disease and cancer, they run back and forth between number one and number two as far as what's going to get you. But certainly we've learned that we can be more aggressive with heart disease and get people, the kind of care they need. And maybe what ends up happening is the vagal and sympathetic tone that goes to that sinoatrial node doesn't get shot, doesn't die in the process. And there's a less of a need. Again, I'm speculating. We should probably pose that question to Dr. Peter McCullough. See if that seems to hold true. So let's move to the eighth branch. It's the second in the chest. This one innervates the lungs. So this is going to help you get that better deep breath. So it's going to it is supplying the front of the lungs, and it joins again with the sympathetics, because there's the entire breathing process is a dance between your sympathetics and your parasympathetics. Your sympathetics, if you decide you're going to lift a heavy weight overhead, you're going to need more air, and you're going to be breathing heavier. So that's going to come up. And then as soon as you put those weights down, you can relax, and that will help. Again, it's that back and forth. So this is the eighth branch is the second in the chest. The third in the chest is the ninth branch, and this is going to the posterior, the back part of the lungs. Again, similar functions. And then the 10th branch is the last in the chest. So I think, I have the chest defined as everything in the rib cage before we get into the abdomen.
above the diaphragm.
Above the diaphragm, especially.
Mm-hmm.
So the 10th branch is the last in the chest. It's, for the esophagus, and it's pretty much left and right. It has been pretty straightforward at this point. After this, now the left goes one direction, the right goes a different direction.
Okay.
So the left vagus at the 11th goes to the anterior gastric, which again, doesn't sound like a big difference, but so it's going to the front and the top of your stomach, and the right goes to the bottom and to the back and bottom portions of the stomach. So you've got two different influences there. And if you've ever thought about, wow, I have heartburn, wonder what's going on there. How is heartburn, the right vagus, where all the acid is largely pulling due to gravity, affecting the heart, also right vagus? Isn't that curious?
That is curious.
So, I mean, are these direct? I don't know. But when the right vagus has problems, the right vagus has problems. And it might affect multiple aspects of the body. So the 12th branch is the left vagus. And it's just all left vagus at this point. And it's all right abdomen. It's going to get your liver, and basically everything around the liver, which is the hepatic plexus. That's what plexus just means. It's all over the place. And hepatic is liver.
And it mixes together. Yeah.
Yes.
And
Go
then
ahead.
I was going to say, and then end of the line. That's where the vagus stops working. It
doesn't
doesn't go under your legs, doesn't go under your toes.
Well, but this is the end of the line for the left branch, or for the left vagus.
Where does the right go?
So the right stays in the right abdomen. It's influencing the liver as well. And it's also end of line. So, but they're a little different. No, here's my right branch. I thought my cornholio meant something. Apparently it didn't.
It was probably a terrible joke that you said in one of your talks.
Absolutely a terrible joke, because there are no good jokes in my talks.
No, there's never not one.
They are all miserable.
They're all awful. They're
so,
as my kids would say, they're very cringe.
I don't know if I'd even call them cringe. They're not even.
They're cringe.
Cringe would imply that they're at least funny. They're not.
I don't think so. No,
they're definitely not. Exactly. Anyways, end of the right of the left vagus in the right abdomen. The right vagus, I was going to say that side looked up very, very familiar. So still 12th branch, we're on the right vagus. This is the celiac branch that then goes to the adrenals, the kidneys, the pancreas, the intestines, especially the upper 2/3 of the colon are influenced by this, and the spleen. So the right vagus is a workhorse all through and through. So that's a huge influence through there. And this is the end of the line for the right vagus. So, and that's, but again, when you think of the nerves coming from the brain, the stomach, or not the stomach, but the intestines, only the upper 2/3 of the colon are being influenced by the vagus nerve. Whereas the lower third of the colon is actually coming up from the pelvis. And this is why, there's not a whole lot of information on this generally, because it's not been studied as much, because the vagus, everything that happens in vagus influences your body, right? Whereas the pelvic nerves, that happens too. So it's less sexy. So yeah. And then no surprise that control of your colon, your rectum, your prostate, your reproductive organs, your bladder wall, and your various sphincters. People are like, those are supposed to work, but we're not going to pay attention to that.
They're kind of important.
It really is, right? So any case, so that's coming up from the bottom. That is coming up from the sacral and your sacrum and affecting your lower part. But there is a lot of coordination from the spinal cord between these sacral nerves and your vagal tone. So that there's a connection there. And
and that's why the doctors, and I'm one of them, that does the Logan Basic technique, is very into this information.
Right, very much so. And And it makes sense because sometimes the thing that's bugging you up top is actually in your hips, and sometimes the thing that's bugging you in your hips is actually up top.
Yep.
So it's good to look. I mean, I do a little bit of sacral occipital technique in the same way as you do with the Logan Basic. And that
but our number one is always the Blair technique, because we can cover so much on that
exactly. Because and the great thing is I've seen many cases of bedwetting, which should be
this
pelvic nerves get better just by adjusting the atlas. So
me too.
No, any case, I have apparently 2 slides of that are identical. It's funny because this little egg guy here, I was introduced to him by one of my patients who happened to be in tonight. Someone's going to tell me exactly what it is. Gumitata, something like that. And this is his thing is he's just like the laziest egg ever. But this is the thing about the sympathetics is they tend to be much slower than parasympathetic supply through the right vagus. So here, let me bring all of these pieces up on this slide. So the sympathetic supply to the sinoatrial node. So this is your pacemaker.
We're back in the heart. We're back in the heart.
Has the capacity to get your heart rate up above 200 beats per minute.
That's pretty fast.
Yeah, it's very fast. And that effect can be seen after 2 seconds, and it peaks at 4 seconds, and it'll end after 10 seconds. Because when you got to get going, it's going to ramp everything up, but it's only going to be around for a little bit because hopefully you got away from the lion. Maybe your friend didn't, but hopefully you did.
Just push him in the way and run.
Yes. Just remember when you're putting your shoes on, take your time to tie your shoelaces, because you only have to outrun your friend. You don't have to outrun run the line. Isn't that horrible? That is. It is horrible.
It makes me. So today at the St. Louis Zoo, there's this bear that has escaped. He escaped like 2 weeks ago or something, and then he escaped again today.
Oh my goodness.
He's the smartest little bear there is.
I was going to say, what's his nickname going to be? Because quite honestly,
Houdini. It should be Houdini.
It should be Houdini. Because there's another bear that I don't know why I kept on seeing the cocaine bear show up recently on various podcasts this week. And I'm like, that's weird, but it's curious. But any case, back to the heart running the way it's supposed to.
Okay.
So the parasympathetic supply to the heart through that right vagus, same sinoatrial node, affects it in less than 1 second and peaks within that second and lasts for only 2 seconds. So it is 80 to 90% faster than the sympathetic supply. So, it's using different, it's using a different chemical. So the speed differential is the neurotransmitter that they're using. And it's a low frequency versus high frequency, which we'll come back to here in just a moment as to why low and high frequency is important. But norepinephrine activates an enzyme complex which takes 8 to 10 seconds to complete, which is that sympathetic. Because you can see, it ends after 10 seconds. Whereas the acetylcholine, which is really funny because the best place to get choline is fresh eggs.
Oh, there you go.
Yeah, which is partly why I put Gudetama there. But acetylcholine is an ion channel activation, and it only takes a second to cause an effect. Okay. So that's why that's why I've got Gudetama there again. Trying to remember why I put a joke into a slide after all this time. So this is why it runs faster. And what we have here is a picture of the brainstem. We're looking at the front part of the brainstem. No, I take that back. Those are cerebellar tonsils. We're actually looking at the brainstem from the back here in this one. But we see a number of different places that influence the nucleus tractus solitarius. Mm-hmm. And one of them is this intermediate nucleus that goes right into there. So it's one step removed. Anytime you have a nerve going into a nucleus, one nerve going into a nucleus will have profound effect on that nucleus. When that nucleus then will have multiple places that it's coming off of to other places. The next nucleus still has a pretty profound effect from step one. And what is interesting when we start looking at the upper cervical is that there is a possible role in autonomic or respiratory control, because the muscle spindles in the cranial cervical junction around the atlas and axis directly influence and go right into that intermediate nucleus, and then one step away from the nucleus tractus solitarius.
Okay, so let's put this into English.
Yes. And I'm gonna show the next picture because I think it helps a little bit better.
Oh no, it does not. Okay.
Yes, it does. This is better. This is better. Lord. A little bit.
Okay. Because what you said is really important, but I want to get it to the point where someone who has not gone to school for this would understand it.
Okay.
But so the muscle spindles, which means like the information that the muscles give to our body. So muscles give information constantly to us.
This is the information coming into the body from the muscle sensation, knowing where it is in space.
The muscle knowing where it is in space, sending that information. That's what a spindle does. Yep. It's sending, and it's going to directly affect when it's up here in the neck.
Yes.
Up here in the top of the neck, up at the upper cervical or the cranial cervical junction. Right. It directly is influencing what's happening in the nucleus, which is like the hub.
Yep.
Right. The hub of cranial nerve 10, which is also known as vagus.
Almost. It is.
Oh, what is it?
So first.
This is the hub before that.
This is the hub before that.
Got it. Okay.
So this is the nucleus intermedius that has a ton of influence to various things, but one of them ends up being the nucleus tractus solitarius. So again, if I was 7 degrees Kevin Bacon, right? Right?
Yes.
It's exactly that.
Okay.
Or maybe it's 6 degrees or whatever they figured out. It's less than, let's use Joe Rogan as an example.
Okay.
There is, if I wanted to tell Joe something, I'd have to go through several intermediaries to get my message to him. But odds are my message will not be the same message. It will be certainly. So for example, let's use Tim Pool as my intermediary. I probably can get connected because I subscribe to his thing. I could probably get one of them to entertain an idea that I presented. They present that to the next level. So, so intermediary 1 then presents it to Tim. Tim says, hey, this isn't a bad idea. He sends it to Joe, but it's got to go through Jamie first. And then it finally gets to Joe. But it's not my idea at that point in time. It's pretty much Tim's idea at this point in time, because Tim says, hey, that's actually a really good idea. I'm going to present that. Now, these guys are good because they won't take credit, along the way. But somebody's going to take credit along the way if it's going to somebody else. This is where you get muddy water in between these signals, between the hub to the hub to the hub to the hub.
Yes. Okay. So, I'm following this now. It took me a second.
Okay, it did. But if for whatever reason, let's just say that Tim Pool and I become great friends,
which would be like your dream, by the way.
Tim and I both. I'm starting.
My friend Tim.
I like wearing beanies. So, any case. So, then Joe Tim introduced me to Joe, and then Joe says, "Hey, I like that idea," and that finally that's that 2-step difference.
Yes,
and that is where the nucleus intermedius talks directly to that nucleus tractus solitarius, and then can have that profound impact on the parasympathetic, the rest, digest, and heal side of the nervous system.
Yes.
Let's back it up to patients who are listening. When you were looking at the graph, the thermography graph that we do every visit, when we take that graph, we are getting a sort of a snapshot of what your nervous system is doing. How stressed out is it?
Yep.
If it is stressed out, and it's stressed out in a way that has caused you to go out of adjustment, we see the same thing over and over and over and over again, which is not a healing pattern. It is because you only have two states of the body. Again, rest, digest, and heal, and that fight or flight. And effectively, fight or flight is breaking down and dying. It gets you away from the lion, but if you're always in fight or flight,
turn off. Absolutely,
it should turn off. But if you're always stuck in that fight or flight, then you are slowly breaking yourself down, and you get sick, and you get exhausted, and you just pass out because you're like, I don't have time, I don't have the energy to do this thing. So, any case, when we see that pattern present, which is controlled by the sympathetics, we know that there is a problem, that something has raised your stress level. Now, does that mean you're out of adjustment every time? Not necessarily. I had a patient in today he's like, I feel great, doc. Mom was in to visit. His mom's like 89, 90, somewhere like that. His mom is like, she's a go-getter. She's all over the place. But he comes in and he's like, yeah, I feel pretty good. I think I'm going to be holding today. And I check him and I'm like, something's off on the graph. I check his legs and he's off. He's pulling a half-inch short, which all is telling me he's probably out of adjustment. But yet I'm not finding the indicators to tell me that he's out of adjustment. So I have him go rest. The graph changes a little bit. The legs are still doing something weird. And I basically tell him, today, you have some underlying stress going on. Take it easy today. This is not the day to go run a marathon. However, be aware of your body, because you may need to get in next week to get checked beforehand. So this is where we can start to see the bigger picture of how your body is in or out of adjustment, or just under stress. And I see that fairly regularly with people. Like today was the day where every time I took a graph, I looked at it and I'm like, yep, we're getting you adjusted today. And when I went to do the leg checks, that was just confirming that it was happening. So this is where all of this nervous system comes into play. I know. I think this graph is and this picture is a lot. But once you start to piece pieces together,
but like someone who's a patient, or someone who's interested in upper cervical care and is not wanting to be a doctor,
right?
In general, just know that there's a relationship between the top of the neck and the cranial nerves,
right? And
we're trying to explain how that then affects the hot button issue, which is vagus or vagal tone,
right? But this also goes to the impact that the upper neck has on the nervous system on a much larger scale. So it's not just fixing your neck for your neck pain. It is affecting everything throughout the body. Whereas, I love traditional chiropractors, but if I've got a problem in the middle of my back, I know guys who pop that left, right, and center all day long. But that is not going to have the same profound effect of the entire body and getting it back into balance.
Yes, absolutely. And a lot of people are like, well, why don't you pop my back? And it's like, it's not that I couldn't. I did know how to at one point, but I absolutely study and am very proficient at adjusting the top of the neck.
Right.
And because I've taken all of that time to do that, a lot of times I don't need to adjust the lower stuff because it just gets better. But if it does, there are 50 chiropractors right around me that can do that for you. I do the thing that they don't do.
Right. So I want to wrap up with a couple things because we're going long here tonight, but both of us have had full days. I want to talk really quickly. So that first picture that I was showing, these two pictures here, the top and the bottom one, that first picture is a heart rate variability picture. Actually, these two red pictures of the red stuff, they're actually the same data, except for the data at the top has not been corrected. So there is a technology called heart rate variability. Oura rings, Whoop straps, it's becoming more and more popular. Apple Watches sort of have it, which is why I'm sort of, the Oura ring sort of has it.
Mm-hmm.
And what it's looking at is the beat to beat intervals that are going on. We do a couple of other things. Certainly we do the thermography and we do the pupillary light reflex in my office now. And we're still seeing what that all pans out to be, so we get a better sense of how well your nervous system, how well your autonomic balance is working. But one of the things that we know about this heart rate variability and why these two pictures look so different, and yet it's the same data, is because the one on the bottom looks like the lub-dub, right?
Mm-hmm.
In fact, I'm going to go to the next slide here real quickly. This is the traditional PQRST, PQRST, there's a U as well, wave. So this is the wave that the heart makes every beat that it makes.
Mm-hmm.
And if you look at the one on the bottom here, you can see that PQRST wave presenting properly. The one on the top needed to be corrected and by hand. And this is a 5-minute sampling. And it doesn't come out looking right until you do each and every beat. And this ends up being the problem with most of our devices, is they're using some sort of algorithm to sort of get it close. So this is why good HRV measurements, first, the equipment costs a lot of money.
Mm-hmm.
Second, takes a lot of time.
Mm-hmm.
And third, the reason I like the Auras and the Whoops, the stuff that is looking at you overnight, is it gets a bigger sample size, so that algorithm actually sort of cleans up the data better than what a 5-minute sample would do. But the 5-minute sample is still a good 5-minute sample with the right equipment will still give you a much better indication of where you are. Any case, let's back up. There are 3 or 4 different measurements that they use for this. One is called SDNN, which is an overall measurement of your variability. And then another one, I think I've skipped 2 things.
Well, before we go way into this, I want to say what you haven't explained yet is heart rate variability.
That's what I was going to talk about just now.
Beautiful.
So let's start right here. For those of you who remember the old keyboards that had a drum track on it from the 80s.
I like them.
Yeah, but the problem with those, the early ones, is you would have such an exacting beat that it would actually drive people crazy. And it didn't sound good because...
was it like a Casio? Is that what those were?
Well, there were Casios. We had a Yamaha one. You know, there's a bunch of different brands that were playing with this. The problem is when you had a beat that was constant like that, you ended up, it just didn't feel good as music goes, which is why when a drummer who's playing a really good beat, you want a good drummer. You know, they're grooving, they're having some fun with it. They're setting that beat, and the beat's pretty much there, but there's a little bit of back and forth tension that goes on. The same tension happens in our body. The more variability that we have, the healthier we are. The less variability, if you're more like a robot, odds are you might be a robot, and that's bad for your health.
That is bad for your health.
So you want that variability in your system so that your body works better. There are a number of different frequency measurements, which goes back to the acetylcholine and norepinephrine mention, where it's like high frequency and low frequency. With that, because the acetylcholine happens quickly, that ends up being, when you do the frequencies, it's 1 over time. So if it only takes 1 second, you take that, you do some math, 1 over 1 second is a very high frequency number, whereas 1 over a big number is a very low frequency number. So sympathetics tend to be more low frequency, and the parasympathetics end up being a high frequency. And what in fact, it was largely the Russians who figured all this stuff out.
Don't start with the Russians.
they've done good research in this field.
I know.
They did really good science. The upside of if you can read a little bit of Russian and get into their old databases of all their health stuff, there's a lot of good health information in there. But in any case, so you've got, there's a number of different ways that we can figure out and piece out these frequencies by looking at the heart rate and then running it through algorithms to figure out what's going on. And again, the vagus nerve largely influences that. And that's why this is
so
a large portion of what we're looking at.
If you have a healthy vagus nerve or vagal tone or whatever we want to call it, you will have a good amount of heart rate variability.
Correct.
Okay. And there's lots of different ways.
Certainly better. And
if you have maybe poor vagal tone or your vagus nerve is not working right, it will be more like it doesn't vary much. It becomes like robot like the Casios or the Yamahas of the 80s.
Correct. Even though some people still collect those things, but that's another.
They should. They're awesome.
Some of those were really good, but yeah. So this is why daily readings in the morning are probably most ideal. Like I said, I like the Aura Ring and the Whoop because they actually give you a overnight sampling. So if you get a bunch of data, if the more data you have, the better picture you get, because you can sort of fudge the data a little bit to say, oh yeah, did really good tonight. Whereas other nights, maybe less so. Or if you got, again, a smaller window. But there are a number of apps on the phone that work with like a polar heart rate strap that you could do every morning when you wake up, slap on the strap, take a 5-minute reading and see where you're at. So, there's a number of different ways if people are interested in doing this on their own. And in fact, I would recommend if you're interested in doing this, instead of trying to find a doctor's office that has heart rate variability, I would invest in one of these technologies to measure to see where you are, because that's going to give you a better picture all the way around.
Awesome.
Dr. Bagley, let's wrap it up. Any other questions? Because I know
you could talk forever on this, and you have before, but in general, I think it was a really good quick overview. I know it didn't feel quick, but there's lots more. Quick overview on sympathetics, parasympathetics, this powerful vagus nerve, and one of the ways that we can test it, which is heart rate variability. But in general, we see incredible results with Blair upper cervical care, and how the interactions with the vagus nerve can happen. We see changes in how their digestive tract works, how their heart's working, how their breathing is. And this could be explanation of why we're seeing this so much.
And I've got a second thing I want to really quickly hit on. When the vagus nerve comes out of the skull, it actually comes out along the parallel to both the carotid artery, which is actually on the inside, and the jugular vein on either side. So it's sitting in between two large vascular pieces. The carotid arteries tend to maintain good muscle tone. Our arteries in general have muscle tone. So if your atlas is out of place, because it's sitting right on top, right on the front. This is like a weird Saturday Night Live thing, isn't it? Anyways.
I think we've lost it.
We do need to wrap, but it sits right on the front part of your atlas with the carotid and the jugulars on either side. And if we commonly see on MRI, when there's a subluxation present, that one of the jugulars, one of the carotids sometimes too, but oftentimes one of the jugulars is occluded, basically shut down and not working the way it's supposed to, which the vagus is right here.
Yeah.
I don't really see
that.
It's affecting the vagus on that side too.
It has to be.
That could be.
So it's not. So what you're saying, it's not just the interaction at the brainstem, but it's actually maybe a physical interaction between the atlas bone, that top bone of the neck, and the vagus nerve itself that's coming out.
That may be possible. That absolutely may be possible. So multiple components, multiple pieces. I mean, how many times do I have somebody come in with, doc, I got neck pains and migraines, and then they say, oh yeah, I had this lung problem that has cleared up recently. And I'm like,
yep.
Did we talk about a lung problem?
Not really,
I never mentioned it.
I just never told you.
It's been around so long. I don't even think about it. So again, it's one of those things. What are all the pieces to the parts? Can we point to one thing? And the only thing I keep on pointing to is the atlas. So
yep, and I do that a lot too.
I do.
Oh my gosh. Well, it was so good to talk to you again. I hope the people listening have heard some things that they enjoyed and also understand better about how your nervous system works. If you could leave us a like, a subscribe, do a comment, that always helps. If you have questions, throw some up there. We will be looking at those and answering your questions in future podcasts. I'm Dr. Beth Bagley, and I'm in St. Louis, Missouri. You can find me at precisionchiropracticstl.com.
And I'm Dr. Frederick Schurger, KeystoneChiroSPI.com in Springfield, Illinois. Time to go get dinner.
Bye, guys.
Bye, everyone.
That's all for today's episode of The Blonde and the Bald. Don't forget to like, share, and subscribe. If you enjoyed today's show with Drs. Bagley and Schurger, remember, don't give up and just live with the pain. Come back next week and get more answers and solutions. Visit our websites at KeystoneChiroSPI.com and PrecisionChiropracticSTL.com for more info, and catch all the episodes of The Blonde and the Bald.